day po sa ating I am Nardeliza A. Lumauig from the College of Nursing PLT, Bayongbong. So, Regeline Acosta will help me in a demonstration of the position that mostly applied in operating room. So, our clinical instructor instructed us to demonstrate a 5 position that usually applied in operating room. So our first position for this day is supine position. So the patient will lie on his back and the pillows will put under her head. I'm going to guide her. So her hand will put both sides. So the procedure that usually done in supine position is appendectomy, abdominal surgery, heart surgery, face and mouth surgery, extremities surgeries, and number 2 position is the lithotomy position. The client will lies on her back. The feet were elevated and in 90 degrees, the thigh will be 90 degrees, and imagine that stirrup is already set up in here, so the feet will be hung in the stirrups. Lithotomy position, mostly procedure done is cystoscopy, transurethral position, cystoscopy, perineal repair, dilatation and curettage, rectal surgery, and more. So that was the lithotomy position. 90 degrees, the thigh is 90 degrees, the feet is flexed, and buttocks is on the edge of the table, and the feet was hung on the stirrup. So our third position is the Fowler position, also called sitting position. So we have the 3 types of Fowler position. We have the low, semi, and high Fowler position. The high Fowler position is 90 degrees. The semi is 30 to 45. Then I'm going to demonstrate the standard Fowler position. It is from 45 degrees to 60 degrees. The patient will be lie on his back, on her back, 30 to 45 degrees. So imagine that our bed is a adjustable examination table. So this is the Fowler position. Mostly surgery that applied is craniotomies, tonsillectomy, nasal operation used by local anesthesia, neurosurgery, then shoulder surgery, and more. So this is the Fowler position. So our fourth position is the prone position. The patient is on her back and her abdomen is put flat in the examination table. Her hand is slightly flexed, and pillows will be going to place under her toes to avoid pressure. Put in the hair. Then mostly procedure that done in prone position is laminectomy, back surgery, and rectal surgery. So this is the prone position that mostly used in operating room. This position is the last that I'm going to demonstrate. So this is the Trendelenburg position. The patient lies on her back, knees at the lower break of the table, shoulder braces attached. So imagine that the shoulder is already have braces in this part. Foot on the table lowered, like this. Then, entire table is tilted at 45 degrees on her head. So this is the Tangular braid position. The surgery that mostly applied or done is for urinary bladder, colon surgery, gynecology operations, and more. So this is the last part, the Tangular braid position. So my demonstration is already done. So I'm going to sum it up all the position that I demonstrate. First, we have the
supine position. Second is lithotomy position. Third, polar position or sitting position. Fourth, prone position. Then the last is the Trendelenburg position.
So, thank you po and good day. I am Nardeliza Lumauig, BSN 3.